there are dozens and dozens of people working literally around the clock on looking at all the elements, just with regard to vaccines. The capacity of the manufacturers to make enough vaccines, the Herculean task of being able to administer these vaccines. It's not a vaccine vial that's important, it's a vaccination that saves lives. And that is one of the biggest jobs that any government will ever undertake, and that will fall to the Biden administration. There will be hiccups. There will be ups and downs. It's not going to happen overnight, but I am confident that the planning that is going on, that we will get this job done. And the staggering numbers that we're seeing today, this epidemic, this curve is still going up, and I don't see a plateau. And we got to get the vaccine right. We have to be able to earn the trust of the American people.
Dr. Kessler, one last question for you on that same point, and that is that I've been reporting, and a lot of people in the news have been reporting, particularly in the past week, on there being some real problems in the transition, not necessarily in the health field. There's been very concerning developments and reports about how the transition has been stymied, apparently deliberately, on a number of national security issues, for example, on some intelligence issues, on some very sensitive issues at the Pentagon. If there are hiccups, if there are problems in the way the transition is being handled around COVID and around healthcare, and particularly around these vaccine concerns, would we hear about it publicly? Would you and your colleagues and those involved in the Biden transition feel like it was safe to tell us if there was something that needed public outcry in order to fix it?
Absolutely. We don't shy away from saying it the way it is. But the docs are working with the docs in these agencies. I'm confident that we will wrestle these problems to the ground, and we will safely have, again, don't want to prejudge it, let's see the data, but we will deliver a safe and effective vaccine to finally end this epidemic. It's a huge, huge undertaking, Rachel. But I am comfortable, even with all the ups and downs and all the difficulty that we will have along the way, we will make it through this.